Hello, everyone. My name is Gabe Capote, and I'm the Unit Chief of the Policy Unit in the Provider Enrollment Division at the Department of Healthcare Services. I'm also joined by Spencer Halsey, Chief of the Policy Administrative Branch in PED, Katie Holtzen, Chief of the Policy and Enrollment Processing Section in PED, and Alex Hernandez, an Analyst in the Policy Unit in PED. Thank you for joining us at today's stakeholder hearing. We will be discussing the draft regulatory provider bulletin titled Updated Medi-Cal Enrollment Requirements and Procedures for Community-Based Organizations, Local Health Jurisdictions, and County Children and Families Commissions, amended on November 17, 2025 for CBO Providers. Please note, the purpose of the hearing is solely to discuss updates to this bulletin. Questions related to billing, rates, managed care, or other provider types will not be addressed during the hearing. For inquiries unrelated to the bulletin updates, please email DHCS PED stakeholder at dhcs.ca.gov. Now we will go to Alex to go over the agenda, reminders, bulletin overview, and updated Medi-Cal requirements.
Thank you, Gabe. Good morning, everyone. My name is Alex Hernandez, and I'm an analyst for the policy unit in the Provider Enrollment Division. Now I'll go over the agenda, reminders, bulletin overview, and the updated Medi-Cal requirements. The purpose of today's hearing is to provide you with an opportunity for a discussion of the draft provider bulletin. For our agenda today, we'll go over some reminders, then we'll provide a bulletin overview, and then review the updated Medi-Cal requirements. Lastly, we will end with comments and questions. Before we begin, I have a few quick reminders. If you are experiencing any technical issues, please email DHCS PED stakeholder at dhcs.ca.gov for assistance. Please hold all comments and questions until the end of the presentation. We will have plenty of time for comments and questions at the end. Please be sure to send any questions or comments made in the chat box to everyone. We'll discuss this in further detail at the end of the presentation. Only written comments received by email by 5 p.m. today will be considered prior to the publication of the final bulletin. You may send your written comments to the following email address: dhcsped stakeholder at dhcs.ca.gov. When submitting your comments, please make sure you reference your name, organization, if you're affiliated with one, and the bulletin title. This hearing will be recorded and posted on our stakeholder hearing information webpage for future reference at a later date. We'll provide a link to the webpage in the chat now. In accordance with Welfare Institutions Code WNI Section 14043.75B, the DHCS Director is updating the specific application and enrollment requirements for CBOs that apply for enrollment in the Medi-Cal program to be reimbursed for the covered behavioral health treatment services they provide to Medi-Cal members. These requirements implement and make specific WNI Code Section 14043.15 and 14043.26, and as such have the full force and effect of law. This bulletin does not substitute for or eliminate all other requirements set forth in WNI Code Section 14043.26. As a reminder, the draft provider bulletin was attached in the stakeholder hearing invitation email that was sent on September 17, 2025. It can also be found on our stakeholder hearing information webpage, which we will provide a link in the chat now. Providers can access Medi-Cal provider enrollment information on the DHCS Provider Enrollment Division webpage. Now we'll go over the updated Medi-Cal requirements. Effective November 17, 2025, DHCS has updated Medi-Cal provider enrollment requirements and procedures specifically for CBO applicants providing behavioral health treatment services offered by Qualified Autism Service providers, professionals, and paraprofessionals. Specifically, CBO applicants enrolling to provide behavioral health treatment services will no longer be required to report the National Provider Identifier, first and last name, and any applicable professional license number, certification number, or registration number of the QAS providers providing behavioral health treatment services within the e-form application. These individuals are also still not required to separately enroll. Continue on with the updated Medi-Cal requirements. Please note the CBO provider organization must still maintain, at a minimum, and make available the following information for DHCS's review upon request for each QAS provider, QAS professional, and QAS paraprofessional. NPI, first and last name, and any applicable professional license number, certification number or registration number of the QAS providers providing behavioral health treatment services. The California State Medicaid Plan and all state plan amendments can be viewed on the DHCS Medicaid State Plan webpage. Now I'll pass it on to Katie for comments and questions portion of the hearing.
Hi, thank you, Alex. Thank you for listening to our presentation about the updated requirements and procedures for community-based organizations, local health jurisdictions, and county children's and family commissions, amended on November 17th, 2025 for CBO providers. If you would like to share a comment or ask a question, you may either raise your virtual hand or type it in the chat box. Please send any comments or questions made in the chat box to everyone. We will go through the chat box first. Then if you have your virtual hand raised, we will unmute you individually so you can ask your question verbally. As a reminder, the purpose of today's hearing is solely to discuss the updates to this bulletin. Questions related to billing, rates, managed care, or other provider types will not be addressed during the hearing. For inquiries unrelated to the bulletin updates, please email DHCS CED stakeholder at dhcs.ca.gov, and we will forward your inquiry to the appropriate division for response. Okay, so I'm checking the chat box now. So if you have a question, you're welcome to put that in the chat. You can also send written comments to our email as well if you choose to do that. I'm not seeing any questions yet in the chat. See any? Are there any questions? Does anyone want to raise their hand and ask a question verbally? I'm not seeing any. No questions. Still no questions in the chat. Kind of just waiting to make sure that there aren't any. Are you guys seeing any hands raised? No?
No, nothing.
Okay, that's okay. Okay. Well, if there are no questions to this update, I will go through a few more reminders and then we will adjourn. I'm going to check one more time just to be sure. Yeah, not seeing anything. No. Okay. All right. So for any questions that weren't answered, there weren't any, but if you do think of a question after, please feel free to reach out. So please note that we will address, well, we didn't get any, so we probably won't have a frequently asked questions document. But if we do receive any questions via writing, we will share our answers to those at a future date. As a reminder, any comments or questions not shared during the hearing can be sent via email at the DHCS PED stakeholder at dhcs.ca.gov. Please make sure when submitting your comment, you reference your name, organization, if you're affiliated with one, and the provider bulletin title so we know what your comments are referring to. We're going to leave the chat box open for a bit so you guys can save those links we put in the chat box for you. And that is it. Thank you for your attendance and your participation, and that the meeting is adjourned.